Hello and welcome. This is Muhammad Wahbi. I will be today doing the clinical scenario 1 for MEDLINE for our EBM assignment, and my colleague and friend Dr. Nadim Aleme will be doing clinical scenario 2 for PubMed. So starting off with the first clinical scenario, let's read it together and try to dissect it. So an adult presents to your clinic with frequent episodes of migraine headaches. She has been reading about dietary supplements and is particularly interested whether these supplements are better than NSAIDs in reducing the frequency and severity of her migraines. So I think one thing to do, so in order to start our search strategy, is to try and dissect the clinical scenario into a PICO. Starting with the population. So the population here we're studying is drugs. So we have an adult presenting to our clinic with frequent episodes of migraine headaches. So an adult with migraine headaches, or adult with migraines, would be our patient population. And this patient is asking us whether dietary supplements compared to NSAIDs are better or in reducing frequency and severity of her migraines. So when it comes to the eye of our PICO, the intervention, we can say that dietary supplements is our intervention. It's the main thing we're looking at, and we want to compare it to something else to see if it's as effective or not. So in this case, it would be our intervention. We are comparing dietary supplements to non-steroidal anti-inflammatory drugs. So in this case, the comparison would be our NSAIDs. And finally, the main outcome of this clinical scenario, the main thing the patient is wondering about is whether these dietary supplements can reduce frequency and severity of her migraines. So the frequency and severity of her migraines would therefore be the outcome of this clinical scenario, and thus our search strategy. We want to see whether ultimately these dietary supplements are better or worse than NSAIDs in helping this patient get over her migraines. So the type of question in this case would be therapy. And the best evidence to find for to answer this question would be RCTs, systematic reviews, and meta-analyses. And bear in mind that meta-analysis would be the best kind of evidence to find in this case. So one way to think about this, after formulating our PICO, we could formulate this clinical scenario into a research question that could help us identify components for our search strategy. So in this case, we could ask ourselves, in adults with migraines, are dietary supplements better than anti-inflammatory drugs in reducing frequency and severity of migraines? And in this research question, we can identify three main components, which are migraines, dietary supplements, and NSAIDs. And these three components are probably the most important to have in our search strategy, so they can be relevant to the clinical scenario. If we miss migraines, or we don't have dietary supplements or NSAIDs in our search strategy, then the point of the clinical scenario, there wouldn't be no point in this clinical scenario. These three main components are important to have in our search strategy in order to answer this question of our patient asking whether dietary supplements are better than NSAIDs or not. Alright, so I'm going to start by typing in migraines, as I did here, since it's our first component of the search strategy that I just discussed, and we're going to search for migraines. So MEDLINE gave us this subject heading, the mesh term of migraines, which in MEDLINE it's called migraine disorders. We can look, we can first of all go into the scope to see whether the definition of migraine disorders is similar to what we want. So in this case, it's a class of disabling primary headache disorders characterized by recurrent unilateral pulsatile headaches, etc., etc. So we know this is what we want in terms of definition of migraine. This is what we're looking for. We can see here references used for, and we can use these to further expand our search. We could rely on these for some keyword generation later on after we're done with the mesh. So we can go to migraine disorders, and as you can see here, under migraines we have different things: Alice in Wonderland syndrome, migraine with aura, etc. So these are all the subheadings of our mesh. So And we can do two things here. We can explode on focus. Explode would take everything about migraines and including what's under it. Focus, it would only focus exactly on the word, for example, migraine disorders. And it would be the main subject of every article we have. So in this case, I'm going to explode to include everything, continue. And here we have the subheadings, different specificities for the mesh we have. So in this case, since we're looking at therapy, we could go over them, and I'm gonna say I'll take prevention and control, maybe controlling migraine headaches, drug therapy, and I think that's pretty much it. I don't think maybe therapy as well right here, and yeah, so I'm gonna go ahead and click continue, and we have 15,000 searches. Now the next step here would be to look at the keywords, different keywords for migraine disorders. Now I already went ahead and constructed the keywords for this mesh. It's right here. I'm just gonna copy and paste it. All right. So as you can see here, I did migraine and I wrote adjacent 3, and I wrote all the words that can be used alongside migraine. So migraine attack, migraine disorder, migraine disease, chronic migraine, frequency of migraine, severity of migraine, migraine episodes, migraine severity, migraine headaches, etc. So I used or. The star is used mainly for example to add missing letters to the word. The question mark is one missing letter, so it would be headache or headaches. So here for example the stars would be episode or episodic or episodes. Yeah, so these are the keywords. I search for them and we wait a bit, see what we get. Alright, and as you can see we have 40k results, which is expected to be more than the mesh since the keywords are very broad, the keywords we're using. And now we can go over and start with our next component. And in this case our next component would be dietary supplements. So go ahead and type dietary supplements and search and see what MEDLINE can give us. Alright, so MEDLINE took us. Dietary supplements is the main mesh term used on MEDLINE, so we can click it again, go over, see what's under it. I'm gonna include everything. I'm going to explode in this case and continue. And in this case I decided just to include all the subheadings and continue. So we have our dietary supplements here as a mesh term. And now time to think of the keywords. So dietary supplements is very broad. A lot of things can be dietary supplements: vitamins, micronutrients, macronutrients, herbal supplements, minerals, specific nutrition. So it's very broad, and this is what I try to do here. So I wrote in this case diet with a star and adjacent 3, and it could be diet supplements, supplements of diet, dietary micronutrients, vitamins, diet vitamins, diet minerals, and same thing for herbal. It's part of the dietary supplements, could be herbal, so herbal supplements, micronutrients, vitamins or minerals, or vitamins on itself, or minerals or micronutrients, etc. So in this case we go ahead and search. And this is gonna take a bit, so I'll let it run. And as you can see here, we got around 617,000 hits, which is great. We wanna have as many papers as possible and collect as many papers as possible with our keywords. And finally, our third and last component would be NSAIDs. So just go ahead and type NSAIDs and see what MEDLINE spits out for us. So in this case, it gave us anti-inflammatory agents, non-steroidal. We click on it, go down, see what's under it. I'm gonna explode, continue. I'm gonna include all subheadings in this case as well, just to broaden our search. And we got 22,000 hits, 226,000 hits. So, and now for the keywords, I already have them written down here. So I'm gonna take them, copy, paste. And I did the same thing for NSAIDs as well. I just include ibuprofen, diclofenac, so different names for NSAIDs that I know of, and we can search. This might also take a bit of time. All right, so we have it with us. We got around 169,000 hits, which is great. And now finally, one thing left to do is that what we're going to do is we're going to expand so we can see everything we have. And now we will OR 1 and 2 because we want either one of these, either the mesh term or the keywords. Same thing for the dietary supplements, we're gonna OR them. And same thing finally for the NSAIDs, we want either the keywords or the mesh, so we OR them as well. And now finally we want the intersection of dietary supplements, NSAID and migraines, so we can see if there's any studies that looked at all three components, migraines, NSAIDs, and dietary supplements. So what we do is we combine all the output we got earlier and we end them. And as you can see here, we got 29 hits, which is a pretty good amount of papers. It's decent, not too many, not too little. So from here we can do two things. We can either limit further by the type of study we want. So for example, if we want to limit further, we go to limits, we go to additional limits, click on 10, which is the last one we had. We can either limit by publication year if we want for a specific year, age groups, languages. So there's a lot of options we have. In this case, for example, I want to limit by publication type, and I want to select the main things that I want in this case, which are RCTs, randomized control trials. I want to see if they have any systematic reviews, and I want to look and see if there are any meta-analyses on this type of search. So I limit the search and just give it a bit so it runs. We limited by meta-analyses, RCTs or systematic reviews, and we decreased the number to 12. Let's have a look at our articles. So as we can see, the effect of alright, so we have our number, it has decreased to 12. We can go ahead and look at our search results. We can see some papers on nanocurcumin, some papers on fatty acids, some papers on omega-3 fatty acids and also curcumin. So apparently curcumin is a big one in supplementation for migraines in some patients and migraine patients. Yeah, but if we always feel like the search is too narrow, we can go back to before our limit. We can see here the effect of mixodin supplementation in migraine patients, vitamin D in migraine patients. So there are some studies on it, but it doesn't seem that big or effective compared to NSAIDs generally, but we'll have to dive into these papers and have a closer look. But anyways, thank you for watching this recording, and I'll give it over to Nadim so he can go over the clinical scenario 2 for PubMed. Thank you.